So welcome. I'm sitting here with Dr. Mertens. We're at Ophthalmopreneurs Congress focusing on refractive surgery, but also specifically the entrepreneurial side of refractive surgery. We have the fantastic setting here looking at the sea and basically Mount Etna in our back. So it's really amazing. Thanks, Erik, for joining me for this conversation. So let's chat a little bit about your experience with refractive surgery and SCHWIND more specifically. So for how long, Erik, have you been in refractive surgery?
Well, that's a very good question, actually. Let me think. It's about 29 years. So I started in 95 with PRK.
Yeah.
Switching very quickly, 97, 98 to LASIK. Already doing phakic IOLs by that time. So that evolved over the years, but still doing all of those techniques nowadays.
That's interesting. And more specifically, for how long have you been working with SCHWIND technology?
Well, I first had another platform, and because of the lack of development with that company, I slowed down with my corneal refractive surgery, and I did more and more phakic IOLs, which gave me great results, even for low myodes. But I heard from my colleagues that the SCHWIND AMARIS laser was exceptionally good and extremely good results. And then, of course, the Atos was introduced, so I switched to SCHWIND and the AMARIS platform and Atos like 3 years ago.
Okay, thank you. So at SCHWIND, our mission is great results for better vision. In your opinion, Erik, do you think we're fulfilling that mission with the platform and the Atos more specifically?
Well, as I said, the AMARIS is already a very established eczema laser platform with great results. Talking to my international colleagues, it was obvious that the results are just not a question about the results. Atos, of course, was the new development in the femtosecond laser business, as you know. And it comes with a learning curve, not only a personal learning curve, but also with the device. And I must say that SCHWIND is very responsive to our experience and our concerns and questions. So the application team and also the research and development team in your company responding very quickly, very swiftly to the concerns we had and trying to make a solution, to bring to a solution to many of our questions we have.
Okay. You mentioned the learning curve. Maybe building on that, it said that lenticule and more specifically SmartSight in our case tends to have a longer learning curve than surface treatment, PRK of course, or LASIK. Maybe you can elaborate on that a little bit.
Of course, yeah, PRK is of course very easy to perform. You just push the pedal and the laser does the treatment. The transepithelial PRK is just easy to perform. Making flaps is of course more challenging, and I have a lot of experience with making flaps, first with microkeratomes. So I experienced quite some complications with the keratomes in the early days, like more than 20 years ago. Turning to a femtosecond laser platform made life much easier. So using the Atos for flaps was just a small step. But it's, of course, there are some in the GUI, there are differences between our platforms. But in the end, it's the same technique. Once you have docking and it's good suction, the laser performs well. And lifting the flap and replacing it was just what I have done. I've performed more than 17,000 LASIK cases, so then you get it in your fingers. Yeah. But lenticular extraction was a completely different ballgame because you have to look at different things. But actually, when you are used to do a LASIK flap, and you have it in your hands that the cornea is curved, this is the most challenging actually in lenticular extraction when you're not used to the curvature of the cornea, and younger surgeons not having that experience with LASIK can have difficulties in performing lenticular extraction. But for me, it was like, the learning curve was pretty steep, I must say.
Great, yes, thank you. Maybe building on that, also on what you mentioned around centration, cyclotorsion. So with the Atos, we try to kind of transport the experiences or the learnings we had with the AMARIS into femtosecond laser. In general, can you elaborate a little bit on the safety aspects of the Atos?
Well, one of the reasons I chose the Atos above the other femtosecond laser platforms was indeed the centration. I must say the centration is flawless with the Atos, and also the cyclotorsion compensation works fantastic in my practice. And of course, yeah, almost every eye has a certain amount of astigmatism. So you want, when you do a refractive procedure on young patients, you want to tackle that astigmatism also, even when it is 0.5 diopters of astigmatism. And you want that correction, of course, in the right axis. And the Atos does that brilliantly. I must say the results are very good. The best corrected distance visual acuity preoperatively matches the uncorrected visual acuity postoperatively in more than 90% of cases. So it's very precise. I did not encounter problems. I did encounter suction losses in the beginning, but with no harm. So that's always good as an eye surgeon to know that you do not harm the eye. You can postpone the surgery and you come back in on a later date. So that's a very nice feature. On top of that, the smoothness of the pattern amazed me as well. And playing with those parameters like track distance and spot distance, I could lower my energy level significantly. Also talking, and that is also something which I brought back from the SCHWIND users meeting, which we can experience and exchange our thoughts and new developments in that field with other colleagues, which makes it very interesting for me to do that new surgery, that lenticular extract, which I started 3 years ago.
Yeah. So you would say, let's say the improvements in spot and track distance, not to make it too technical, but still you would say it's an important element of your femtosecond experience.
Yes, in the beginning you begin with high energy settings, and then you see that OBL, that opaque bubble layer, and then it takes some time for the vision to recuperate. Mm-hmm. It takes a couple of days, sometimes in the beginning even 10 to 14 days to get to 20/20 uncorrected vision. Of course, competing then with LASIK is difficult because LASIK 1 day post-op is, most of them are 20/20 uncorrected 1 day post-op. So talking to other specialists in the field using your SmartSight Atos platform, they taught me how to lower the settings. So increasing the spot distance in respect to the track distance made life much easier. So lower energy settings, but still able to dissect the lenticule very easily and extract it fully. We could go to 20/25 uncorrected 1 day post-op. And in most cases now we are even at 20/20 uncorrected 1 day post-op. So matching almost, not completely yet in my hands, the same 1 day post-op uncorrected visual acuity results than with LASIK.
So this is a challenge for us to work on together with you to get there.
Yes, that's why the interaction is very important between the industry, you as SCHWIND, and we as eye doctors. And that's what I like about your company, that you listen to us and you react quickly and swiftly. The R&D team is fantastic to bring the solutions very easily and very quickly to market.
Thank you very much. Always nice to also hear the things we're doing well. Our vision is a better quality of life for patients, and more specifically also with laser vision correction, growing the category of laser vision correction of refractive surgery. Do you think we are fulfilling this with the Atos device specifically?
I think there are things to consider here. First of all, safety is number one. You're treating most of the time very young people, young eyes, which need their eyes for their next 60 to 70 years. So safety is paramount. And that is what your platforms deliver very good. Working with those developments, it's very important that you have the whole portfolio. Not only PRK, not only LASIK, not only lenticular extraction, but also refractive lens exchange and fake IOLs. So I think it's very important me as an eye surgeon, that I can choose out of all those procedures. So that's what I tell my patients as well. First of all, we do all the workup. We do all the tests from retina to do you have dry eyes, yes or no, and so on and so on. Then I make one recommendation, because when you give the patients 2 or 3 recommendations, you are a candidate for LASIK, you're a candidate for SmartSight, you're a candidate for AKWs, they get lost. Yeah. It's like being in a restaurant and you have 15 nice dishes you like, you cannot choose. It's the same thing. So that's what I tell them. So, okay, I have almost 30 years of experience in refractive surgery. We look at your eye very carefully. I listen to the patient, their lifestyle, what are their hobbies, and so on. And then I make one recommendation. And, well, that's building trust with your patients is very important. And ATOS and lenticular extraction is one of those procedures. I must say I'm performing more and more lenticular extractions than I do flaps nowadays, because of what we see, the advantages of very small incision, fast visual recovery, with actually, we tell our LASIK patients not to rub their eyes for 1 month, be careful when swimming and so on. With the lenticular extraction SmartSight procedure, they can rub their eyes. Of course, it's never good to rub your eyes, but even when they do, nothing will happen. Yeah. And also in the long run, when you have like a trauma, a sport trauma or something, you get a ball in your eye, the flap will not dislocate because there is no flap. So that is in our armamentarium of procedures a very good step forward.
Okay, great. Thank you. You talked a lot about the benefits for the patients and the advantages, which I think is the primary goal, of course. It's what we need to look at together, industry and surgeons, to really deliver great results to patients. At the same time, we are at ophthalmopreneurs, so it's also good to look at the entrepreneurial side. Would you say that especially in your experience, where you kind of reduced your corneal work at some point, and then now with the SCHWIND platform basically came back to laser vision correction, that this addition and this offering of additional treatments, that it had a positive impact also on your business in terms of your practice?
Well, yes. So as I said, you cannot in these days, you cannot perform one procedure and neglect all the others. And technology advances. Lenticular extraction was the latest advancement in corneal refractive surgery. And also in your platform, you will offer, I think, very soon, the tunnels for to put in the rings, which is another addition, a therapeutic addition.
Few weeks.
Within a few weeks. So you see, I know what you're doing, and I like it very much, because there's you have more and more patients coming in. So with keratoconus, because of the different population demographics in Western Europe and specifically in Belgium, I must say. So that population is more prone to keratoconus, and we need to treat them as well. So in that regard, it's broadening our patient population, and also patients, they know that we offer all the procedures and we pick the best one for their eye. So that's what building trust in refractive surgery is of the utmost importance.
Great, thank you very much. That was really a great conversation. Thank you very much.
You're very welcome.
Enjoyable setting. Thanks for your time.
Thank you, Dominic.